Our face is our identity, and over the years it undergoes a lot of wear and tear. So the effects of aging start showing on your face. There are various ways of facial rejuvenation which we can perform, which can be done surgically as well as non-surgically to restore the youthfulness of the face. So what are the non-surgical techniques which are commonly used? So the most common technique of non-surgical facial rejuvenation is the use of Botox or botulinum toxin. This is used for relaxing the lines and wrinkles which are commonly formed on the forehead, around the eyes and around the mouth. So this is a day care procedure. It's an OPD based procedure, and it needs to be repeated every 6 months though. The other commonly performed procedure is the use of fillers. So fillers are also certain neutral medications which are injected on an outpatient basis, which also help in decreasing the hollowness in certain areas like the nasojugal folds or the tear trough areas or the laugh lines or the jowls. So the fillers are also a common technique of improving the facial contour. Coming to the more permanent or the surgical techniques of facial rejuvenation. So one of the most effective way is to do a blepharoplasty surgery. So blepharoplasty or eyelid lift is done for the upper or the lower eyelids or both the upper and lower eyelids. As we see that over a period of time, because of aging, there is a lot of loose skin which forms around the eyes. So with the help of eyelid lift, we can actually tighten this and remove the skin which is there in the upper or the lower eyelids along with the fat bags which form under the eyes and restore the youthfulness of the eyes. This is also a simple day care procedure, and the patient can actually go home on the next day of the surgery itself. Some other procedures for facial rejuvenation include a face lift procedure, in which we can actually correct the mid-face sagging as well as the jawline sagging and the double chin which is commonly seen due to aging. And the incisions in this case are taken in the pre-auricular crease. So this actually is not visible to the naked eye. So these are some of the commonly performed facial rejuvenation techniques. Apart from that, another novel technique which we commonly use in Wockhardt Hospital is the use of fat grafting along with growth factor concentrate. So in this case, we actually extract fat from certain areas of the body like the abdomen or the thighs. This fat is then centrifuged, and this fat is then permanently injected into certain areas of the face. For example, the malar fat pads which undergoes sagging over a period of time, or the jowls or the laugh lines. So this fat is then injected into these areas permanently, and the repeated use of fillers can be avoided once the fat injections are done. So this is also a minimally invasive procedure with long lasting results which we performed at Wockhardt Hospitals.